Gait is an extremely valuable topic to truly comprehend. As a physical therapist, we took courses and observed and continue to observe our patients' gait. The problem with how gait is presented is that as you take it in a course, I find that a lot of us just memorize things. When it comes to memorization, sure, you might do well on the test, but then it gets hard to truly comprehend it in the future. So what I want to do is hopefully simplify the components of gait and put it in more of a system that looks at principles. And when we understand the principles, we can then actually start to understand why our patients are compensating and then what we need to do about it. So the really cool thing about these principles is that it's not just specific to walking. Instead, I want you to think about when someone goes through their full gait cycle. If they perform it in a relatively non-compensatory manner, chances are they probably have little to no pain. However, if there is a certain pain point at a certain time, once we apply these principles, we will be able to better understand what's going on from a gait perspective, walking, but not just walking. How does that affect the pelvis, the trunk, the rib cage, breathing? And so we can start to integrate these principles to better understand movement as a whole. And that's why gait is so powerful. And I think a lot of us miss out on the opportunity to use gait information in other parts of our treatment. And you'll see what I mean once we start going through these principles. But take that and keep that in mind as we go forward, that this is not a walking video, this is a movement video. So that brings us to step number 1. Categorize movement. So we can simplify our understanding of all human movement while also getting better at recognizing compensations by breaking movement down into 2 categories. So go ahead, grab a pen and paper or your cell phone so you can jot this down. That way you can reference it as we continue moving forward. So on one side, go ahead and write down external rotation. On the other side, internal rotation. Underneath external rotation, jot down the following: counter nutation, flexion, abduction, plantar flexion, supination. On the internal rotation side, go ahead and jot down nutation, extension, adduction, dorsiflexion, pronation. Now, before I gave you those 2 different categories, I said that it can help you simplify your understanding of movement and get you better at recognizing compensation. So the first part, it helps us understand movement as a whole because instead of getting caught up in all the different motions, we just think of 2 primary motions: external rotation and internal rotation. We recognize that when we are seeing something like flexion or abduction, that is an ER biased motion. This is the body's way of producing space. The body needs to find space, aka ER, then it's going to go into internal rotation or to produce power. So if we're looking at someone pronating or internally rotating, it's the same thing. They're finding power. Now, how does that help us recognize compensation? Well, if we're in a specific point during a movement that we should be externally rotating, or let's say plantar flexion, but we're seeing dorsiflexion, we know that they're compensating. They don't have the space, so they're prematurely going to the next phase, or they're finding other ways to do it. There's a million different ways it could be. The big takeaway is that we are compensating. So it helps us look and recognize that this person should be doing X, but they're doing Y. So now we can better give them interventions that fixes the problem. So that brings us nicely to step number 2, which is link movement to the gait cycle. So all we're going to do is reference 3 phases, and those phases are early, mid, and late stance phase of gait. Once you look into a textbook, if you were to open up and look at the early stance phase of gait, the majority of the movements that you would see would be counter nutation, flexion, abduction, plantar flexion, and supination. That is the external rotation category, right? So during the early stance phase, we have an ER biased phase, meaning the body is biased and going through external rotation really throughout pretty much the whole kinetic chain. So that's early space. Then we go to mid stance phase. What happens at that mid stance phase of gait? Well, again, if you look at any textbook, you would start to see nutation occurring. You would see extension, adduction, dorsiflexion, pronation. What is that signaling? That's signaling an IR biased phase. So mid-stance phase is an internal rotation bias. Then we move to late. What happens? Well, you probably already know. We resupinate. What is resupination a part of? External rotation. So the body starts to go through external rotation. So we can genuinely master the gait cycle by just understanding early, mid, and late, or ER, IR, ER. So back to our reference that we talked about previously, it will make a little bit more sense now. If you are in the IR phase of gait, mid-stance phase, but you are seeing ER mechanics, this person is going to have pain, right? So we just took the whole gait cycle, which there's textbooks and courses on, and we can start to genuinely understand all these motions by just looking at ER and IR. Now, we can start to use that information to better prescribe exercise, and we do that with the shin angle. So that brings us to step number 3. Link movement to the shin angle. Now, in the very beginning of the video, I talked about how this isn't a gait video, but now you're going to start to see we're using the gait cycle like we just talked about, but understanding and using the shin angle to represent what phase of movement we're in. Now, if we're doing a lower extremity exercise, we're not walking, but we can understand the same principles. Let me explain. So we have our early, mid, and late stance phase. Early, when it comes to our shin angle, is going to be represented by a negative shin angle. So this is when the shin is behind the ankle. Our mid stance phase, or internal rotation, is when we have a neutral shin angle. So the shin is right above the ankle. And then our late, or our re-external rotation, is a positive shin angle where the shin is forward relative to the ankle. So what you're going to see here in a second is that we can choose different lower extremity exercises to bias that person into external or internal rotation. So if they struggle to achieve internal rotation, we can get very specific with the exercises we prescribe. And what would you want to prescribe? You'd want to prescribe an exercise that has an internal rotation biased shin angle, aka a neutral shin angle. What does this do? This is going to help us pronate more, dorsiflex more, adduct more, extend more, nutate more, right? All movements of internal rotation. So that's why really understanding those first categories is super important. But big takeaway here is understanding that the shin angle, when you are watching someone do exercise, not walk, but do exercise, helps you understand what they should be doing. And it's up to you to understand if they're doing that. So now let's look at specific examples as to how we can bias our shin angle to improve ER or IR. So early, our first, we are looking for a negative shin angle. The front foot elevated split squat is a great and really simple way we can achieve that. The setup, because that front foot's elevated, already puts this in a negative looking shin. And then we're just going to go through our normal lunging or split squat mechanics. So again, elevating the front foot, really easy way to bias a negative shin angle. If you're looking for the mid phase, which is our internal rotation or neutral shin angle, a normal old reverse lunge is a great option. And so you can see, compared to the first one, this one, we land pretty much right over the ankle for our neutral shin angle. Lastly, a rear foot elevated split squat is a great way we can start to get a positive shin angle. So we throw our foot back, and because we really can go down into that, it allows that tibia to translate forward and produce that positive looking shin angle.